everyone, it's Dr. Maricon, and we are doing part 2 of the cardiovascular system lecture. In this part, we're going over the last 2 learning objectives. So next, we're going to solve case studies, or a case study related to coronary cardiovascular disease, and then we will describe how blood pressure relates to the cardiac cycle. So if we take a look at this, what do you think this is? We can see a vast network of vessels, kind of in the shape, a specific shape, possibly the shape of the heart. So what we're looking at is actually the coronary circulation, and these are the vessels delivering blood to the heart. So here we see a typical picture of the outside of the heart, kind of have a pointing apex right there, and you can see that specific heart shape. And then if we take a look and compare the two, we can see that the vessels surround the heart, giving blood supply to the heart. Now, the heart cells do not get a lot of nourishment from the blood it is pumping. Why not? Well, most of this is being pumped to the rest of the body. Plus, the heart has very thick muscle layers. So we see the outside of this heart, and we can see how thick these layers are. And when we cut into an actual heart, we can see specifically the ventricles as well, the thick muscle layers. So basically, it needs its own vessels to deliver oxygen and remove carbon dioxide. This is the coronary circulation. So the heart has coronary arteries. It has a right coronary artery, if you can actually see here, and a left coronary artery coming from the first part of the aorta, specifically the ascending aorta, or the part of the aorta that comes up from the left ventricle. So the right and left coronary arteries are the arteries that give blood supply to the heart itself, okay, and that give blood supply all over, because we know that the heart is a muscle. And if you watch this video here, this is actually a video of a 3D video of how this works. It's not very long video, so if you guys want to check it out, I definitely would. Now, there are things that can affect the heart, specifically a condition known as atherosclerosis. Atherosclerosis is a common cause of cardiovascular disease. Now, this is due to the hardening of arteries due to yellow fatty deposits that may increase in size and harden and therefore restrict blood flow. So here we see a normal coronary artery, nothing within the lumen or that space within that vessel. Blood flows pretty freely. However, when we get those thick yellow fatty deposits, usually due to high fat diets, lack of exercise, maybe genetics, we can see that this buildup kind of occludes or decreases the diameter of the lumen of that blood vessel. And then what happens? Either the fatty plaque could break off, or we could have blood clots that could end up occluding or completely cutting off that blood supply within the coronary artery. And what will happen is, if we don't get blood supply to that part of the heart, of course, what happens? We have ischemia, where there's lack of oxygen. Without oxygen, that muscle will die. So the death of the muscle within the heart is called a myocardial infarction, so also known as a heart attack. So the buildup of the plaques within the coronary arteries causes this infarction, or and eventually the death of that muscle. So atherosclerosis can cause heart attacks or myocardial infarctions, which is sudden death of an area of the heart due to the lack of blood supply. Now, don't confuse this with the term cardiac arrest. Basically, cardiac arrest is when the heart stops pumping blood, and this is very suddenly, which is often due to electrical problems such as arrhythmias. Okay, so arrhythmias are rhythms of the heart that are not the normal rhythms of the heart. Okay, so myocardial infarctions and heart attacks are different from cardiac arrest. Now, physicians will use an angiogram or an angiograph to visualize arteries. Angio means vessel, and graph basically just means a graphic representation. This YouTube video is actually a 10-minute video showing how surgeons use angiography to perform angioplasty. So again, angio means vessels. Graphy is when we kind of want a visual representation of the vessels. Angioplasty, plasty means surgical repair of. So angioplasty is the surgical repair of a vessel, specifically one of the coronary vessels. So how do they perform angiography? Basically what they do is they will take a catheter and it's threaded through the artery or the arm, the artery of an arm or a leg. Here they will enter through the femoral artery, and the catheter will go up that artery through the aorta into the heart. So we can kind of then go into the different blood vessels coming off of that first part of the ascending aorta. So we know that the right coronary artery and the left coronary artery are direct branches of the first part of the aorta. So again, this YouTube video is showing how surgeons use angiography to perform angioplasty. You can stop around 3 minutes, but it's actually kind of cool. From there, they will squirt a high contrast dye. So this dye will color the vessels so they can see the vessels up on a screen. The movement of the dye is imaged and recorded through a series of high-speed X-rays. So here is an actual angiogram, and we can see one of the coronary arteries flowing and the contrast dye flowing through the arteries. However, if we see sort of a pale area where no dye is getting through, this could be indicative of blockage within the coronary artery. Okay, so if we see this, then we definitely, are in trouble because we want to replace that blood supply so that that part of the heart muscle does not die. Now, blood pressure is the force the blood exerts on the walls of the blood vessel. We need blood pressure to effectively pump blood. However, if the pressure is too high, it can damage tissues. So one of the most serious problems related to untreated high blood pressure is atherosclerosis. Now, why is that? It's because over time, untreated high blood pressure, that extra pressure can actually damage the walls of the arteries. They can be made more vulnerable to the narrowing and plaque buildup that is associated with atherosclerosis. So that extra high blood pressure, again, damaging the walls of the vessels. We actually saw that when we talked about aneurysms, how the weakening of the walls can cause those aneurysms, which may eventually burst and cause a lot of damage. So when you have high blood pressure, it causes more stress on your blood vessels and then puts you at risk for conditions such as atherosclerosis. So here we're going to talk about a case study. 60-year-old male comes to the ER complaining of tightness and pain in his chest that radiates to the left side of his arm. Doctors perform an angiogram and see that there is blockage in the left coronary artery. So here are some case study review questions for you to review the information that we just went over. How are the coronary arteries different than the arteries leaving the heart, specifically the aorta? What is atherosclerosis? If the coronary artery becomes completely blocked, what could happen to the function of the heart, and how will this affect the supply of oxygen to the rest of the body and tissues? And then how does untreated high blood pressure put a patient at risk for atherosclerosis? So I would definitely review the slides that we just went over and review these case study questions because you will definitely be tested on these. Now, how can we prevent cardiovascular disease? As a physician, I often recommend a lot of lifestyle changes. For example, control weight and exercise. This can help lower blood pressure. Basically, if you decrease your weight, you're not forcing your body to pump blood as hard as you would if you were overweight. Also, exercise. Exercise can help you control that weight. Also improve circulation to the rest of the body. Don't smoke, guys. Smoking is just such a terrible habit, and there's so many side effects that can occur from smoking cigarettes. So nicotine actually increases heart rate and constricts blood vessels. This in turn will increase blood pressure. If the blood vessels are constricted, meaning their diameter gets smaller or the lumen gets smaller, the heart has to pump harder to pump this blood through these narrow constricted blood vessels. So guys, just don't smoke. It's disgusting. Eat a healthy diet. So limit your saturated fats and trans fats. These raise the levels of bad cholesterol that can encourage the formation of those atherosclerotic plaques. Limit salt intake. Salt affects fluid retention and blood volume, so this will increase blood pressure. So guys, take it easy on the salt. Now, how does blood pressure relate to the cardiac cycle? So now we're going to take a look at blood pressure and the events that occur when the heart beats. So what's happening in a single heartbeat? We've been kind of raised to believe that the sound of a heartbeat sort of sounds like a love dub. So, love dub, love dub. Now these heart sounds are due to the closing of the valves. Okay, that first heart sound, love, is basically blood recoiling or pushing up against the closed atrioventricular valves. Okay, so once blood flows through the atria into the ventricles, these atrioventricular valves will close, and then when the ventricles contract, the blood will push up against these closed valves, causing that first heart sound, love. The second, dub, basically is the sound when blood recoil pushes up against the closed semilunar valves, the valves between the ventricles and the blood vessels, the pulmonary valve on the right and the aorta on the left. So that second sound is the closure of those semilunar valves. Now, during a single heartbeat, both ventricles contract together, and then both atriums will contract together. This is the part of the cardiac cycle known as systole. With relaxation of the heart, this is called diastole. Okay, some people say systole, diastole, or the systole, diastole. So the cardiac cycle are the events associated with blood flow through the chambers during a single heartbeat. Okay, so during a single heartbeat, we have contraction of the ventricles, then contraction of the atria, known as systole, and then relaxation, which is diastole. So this YouTube video actually shows you the events of the cardiac cycle. It's about a 2-minute long video, so if you guys want to check that out, you're more than welcome. So first we're going to talk about atrial systole. This is when both atria contract and force blood into the ventricles. So the right and left atria will contract at the same time, forcing blood into the right and left ventricles respectively. Then we have ventricular systole. This is when both ventricles contract. Now at this point, the valves between the atria and the ventricles will close. Blood is ejected then into either the pulmonary trunk on the right, or to the pulmonary arteries, and then into the aorta on the left. Okay, and this event has the opening of the semilunar valves. So blood is basically being forced into the lungs or forced into the aorta to go to the rest of the body. Then we have the rest of the cardiac cycle, which is diastole. This is the event in which the ventricles relax and fill passively with blood. Okay, once the blood that was in the ventricles is pumped to either the lungs or the rest of the body, it will then relax, allowing for blood to flow from the atria back into the ventricles. Now, what does blood pressure have to do with the cardiac cycle? So blood pressure is measured at the highest and lowest points during the cardiac cycle. Systolic blood pressure represents the highest point. This is maximal ventricular contraction. Okay, so when we think of systole, we think of ventricular contraction. This is when the ventricles pump the blood either to the lungs or to the rest of the body. And of course, at this point, when we have ventricular contraction, we have closure of the atrioventricular valves so that blood does not backflow into the atria. Diastolic blood pressure, or diastole, represents the lowest point. This is minimum ventricular relaxation. So once blood has been pumped from the ventricles, either into the lungs or into the rest of the body, it will then relax to allow for filling of blood, or ventricular filling. So blood pressure is represented by by numbers. We have the systolic number on the top and the diastolic number on the bottom. So systolic pressure represents peak pressure, or the maximum amount of pressure it takes to push blood from the ventricles either into lungs or specifically into the aorta to the rest of the body. Usually the max pressure we'll find is the pressure from the left ventricle to the aorta, so we consider that the systolic pressure, or representing the systolic pressure. So pressure from the left ventricle into the aorta. The bottom number is the diastolic number. This is ventricular filling, so this is the minimum amount of pressure. So we can see that the number here on the bottom represents diastole. So the number 110/70 is a person's blood pressure. Now we have different ranges that have been determined by the American Heart Association with regards to, range of a good range for adult systolic blood pressure over adult diastolic blood pressure. And they do change every year. Usually the range for systolic is anywhere between 100 to 120. Whereas diastolic is anywhere between 60 to 80. That is considered the normal range. And any increase or decrease above or below those ranges, then we run into problems. We can have hypertension, which is blood pressure above the normal range, or hypotension, which is blood pressure below the normal range. So how do we measure blood pressure? We have an apparatus called a sphygmomanometer. Sphygmomanometer is just a fancy term for a blood pressure cuff, with it attached a little bulb that pushes pressure into this inflatable cuff, also attached to a gauge. Okay? And then we use our stethoscope to auscultate the flow of blood through a blood vessel in the arm. So basically, we are cutting off the brachial artery, ideally within the arm, and then measuring what pressure the blood will start flowing into that artery. Okay, so we take our sphygmomanometer, we wrap it around the arm, and then we pump up this little bulb to inflate the bladder within the cuff to occlude the brachial artery. We'll then put our stethoscope sort of at the distal portion of that artery to listen for sounds. These sounds are called Korotkov sounds, okay? And the pressure that we normally use, in this picture it's saying 150 millimeters mercury. Normally that would be the pressure it would take to occlude the brachial artery if the person is within normal limits. However, because we are not aware of a patient's history, or we don't know if their blood pressure is actually above normal, sometimes we can inflate it anywhere to 180 to 200 millimeters mercury. Now we use the unit millimeters mercury because back in the 1900s, they actually used to use an apparatus that used a tower or a line of mercury within the apparatus to measure the numbers. We know that mercury is no longer safe, so we don't use mercury, but we still use the units. So we can increase the pressure within the cuff to anywhere between 180 to 200, and at that point, so we have this little dial that controls the amount of air that's going into the bladder of the cuff. So then we will slowly release the pressure and slowly allow blood to flow back into that artery that we are occluding with the sphygmomanometer. The first sound that we hear is a thumping sound, also known as Korotkov sounds. The first sound we hear will be the systolic pressure. Okay. Again, systolic pressure can be anywhere between 100 to 120 millimeters mercury. Now, we keep releasing the pressure within the cuff. We keep hearing this thumping sound, and it slowly starts disappearing. Now, the point at which we no longer hear those Korotkov sounds, that is how we measure the diastolic pressure. Okay, so the first systolic pressure is when we start releasing the pressure within the cuff, and we hear that first thumping sound, and record that number. Then the second sound is when the thumping disappears, when the Korotkov sounds disappear. That is the diastolic number. Again, diastolic can be anywhere between 60 to 80 millimeters mercury. Okay, so I've included a YouTube video that actually explains how to take the blood pressure and the type of sounds that you may encounter when you are doing taking the blood pressure. Unfortunately, we don't have in-person labs, and I can't show you how to do one. But for the most part, I would definitely take a look at this video with regards to the type of sounds that you would hear should you take a blood pressure measurement. Okay, and that is the chapter on the cardiovascular system.